Right now, we have a follow-up to a Target 8 investigation into the growing problem of drug-exposed babies.
It was just last year that we first took you inside the short lives of 3 West Michigan babies, and what Target 8 investigator Susan Samples uncovered prompted a leader in public health to reach out to the state to offer help.
That's right, Brian and Marley. These are babies born with drugs in their systems. It's a growing problem in Michigan and one that presents big challenges for Children's Protective Services. After Target 8 reported that CPS doesn't necessarily track babies born drug positive with illicit drugs in their system, the Kent County Health Department stepped in to offer help. 3 babies all born with illegal drugs in their systems, but they had something else in common too. They all died within a year. Not from drugs directly, but from things like unsafe sleep. And in one case, the cause was never determined. Children's Protective Services knew these babies were born drug positive. Caseworkers visited their homes one time, did a standard risk assessment, and closed out the cases.
They're required to open an investigation. Very frequently, that investigation is closed very quickly because they didn't necessarily see during their one-home visit the whole scenario.
Joanne Hoganson is in charge of public health nurses and social workers at the Kent County Health Department. When she saw Target 8's investigation, she recognized that her visiting nurse program could help.
So following seeing that report, I made some phone calls to CPS the very next morning and said, look, I think I have another alternative for us.
Hoganson has been working with CPS and lawmakers on a bill that would require a, quote, plan of safe care for drug-positive newborns. Getting a series of visits from a public health nurse would be part of it.
One of the beauties of having our nurses and social workers go in is that we have Medicaid funds to go in 9 times during the first year, as opposed to 1 visit. So it's a much more complete holistic approach.
It's also more expensive, though Hoganson says the initial cost will ultimately save taxpayers by producing healthier, more stable families. And if the home isn't safe, the nurse would call CPS in.
Our nurses would see that. They would recognize that. But in many cases, what the mom needs is help. She doesn't need her child taken away. She needs help to overcome her addiction. And that's where our nurses come in, and they connect with the resources.
I checked in today with the senators who introduced that safe care bill last May. They told me this issue is a priority, but it will be some time before that bill gets a hearing because the issue is considerably more complex, they say, than it appears at first glance. CPS is working with lawmakers on this and told me today that Kent County has been a great partner in this effort. We'll track developments. I'm Target 8 investigator Susan Samples.